But then other times I get feedback that actually people didn't realize they had to think about things like sleep or their gut health or what they've had done in the past. Have they taken antibiotics? How's their immune system generally? What kind of food do they eat? And as they're filling in the form, they actually become more aware that there are certain lifestyle issues that they may be able to improve that could then improve their skin symptoms. So I often start with that. And I go back even to when they were in their teenage years and their like childhood years, because I want to know, were they breastfed? Did they have a lot of antibiotics? Did they have a lot of skin conditions or skin allergies? Because I think we know now that for eczema, for example, if we are able to improve the mother's immune system with probiotics, that can actually lessen the chances of children getting childhood eczema. So I think going back even to that level gives me an idea as to how good was this person's gut health and how diverse is their gut microbiome, because we're now more aware of the fact that gut health actually has a connection to skin health. And in fact, it was probably around about 80 years ago that there were two dermatologists called Stokes and I forget his other name, Pillsbury. So they actually coined the term the gut-skin axis. So they actually hypothesized at the time that people's emotions impacted on their gut flora, which then affected their skin health. So that was amazing for like two doctors who didn't know anything about gut health as we do now.
And so early too,
to
right,
hypothesize.
as well.
Yeah, so I like history because I like to look at what other doctors generations ago thought, and that's pretty much where I feel that the research is now going, is confirming a lot of these things, and we're understanding more about the pathways and the mechanisms. And so when we go back to acne, I look at all that history because we know that things like stress and low stomach acid, certain toxins in the food that we eat and chemicals in the environment can impact on the diversity of our gut microbiome. And that can impact on how well that gut barrier and immune system functions, which then connects to the pathways. So one of the pathways that is very interesting, and it's not often talked about, has to do with neuroinflammation. So there is a neurotransmitter called substance P, and this particular neurotransmitter is not often talked about, but it links neuroinflammation in the gut to the skin. So when this neurotransmitter is triggered, you actually get more inflammation in the oil glands, and it also causes the skin microbiome to become more inflamed. Wow. So I think like we're understanding more of how these relationships are working. And again, there's so much more research, even just talking about gut permeability and how food and the types of food that we're eating, even though they could be healthy, can trigger an overactivation of the immune system, because the more our gut becomes permeable, the less it is able to balance the immune system. So in the past, when we read about acne, don't eat sugar or chocolates or cheese or certain types of foods. And we weren't really able to pinpoint or identify a particular group of foods, because everyone's immune system is different, because everyone's diet is different. So that's why I think there's always been a bit of confusion about, should you exclude foods or eliminate certain foods if you have skin conditions. And I think it depends on the different types of skin conditions, and currently we do have some observational studies that, for example, with acne, it's foods that are high in sugar, and for eczema, for example, it could be dairy, and sometimes for psoriasis, we've actually seen an association with gluten, and with rosacea, not so much, or spicy food with rosacea. So we're really starting to see like some commonalities in the different disease groups. but there's also a lot of variability amongst different patients. So I often go through a patient's diet. I ask them what do they eat often, and do they have other symptoms apart from skin symptoms? Do they have bloating in their gut? Do they get joint pain? Do they get chronic fatigue? Do they have sleep issues? Do they have reflux? So I ask them about these questions, and then I put together what could be a triggering issue for them, and work out how severe is their skin condition, how frequent they're experiencing it, what other treatments have they had from other doctors, and work out a way of changing their diet, getting them to focus on some areas like sleep, for example. But often I find that some patients are, especially here in Hong Kong, people are so busy and they have so many things to do, even in the early hours of the evening, that some people are just getting 4 or 5 hours sleep.